You may believe that stroke is something that only happens to the very old, or that it strikes suddenly without warning. The truth is more frightening. Stroke is now the second leading cause of death worldwide and a growing threat even to younger people. Yet it remains most devastating for seniors, especially women over 55. Every year, millions lose their independence, their memory, and their ability to walk or speak. Not because help was impossible, but because the warning signs were ignored or action came too late. What most do not realize is that stroke is not a random act of fate. It is the result of blocked arteries, ruptured blood vessels, uncontrolled blood pressure, or silent medical conditions like atrial fibrillation. These problems build quietly over years, hidden by normal routines, until one day the brain is suddenly starved of oxygen and nutrients. Within minutes, brain cells begin to die. That is why recognizing symptoms early and acting immediately is not optional. It is life or death. I have seen patients who mistook sudden dizziness for fatigue, who ignored blurred vision, who brushed off numbness in an arm as just sleeping funny. Hours later, they were in intensive care, facing permanent disability that could have been prevented. Stroke does not only take away movement, it can take your ability to speak to your loved ones, to feed yourself, to live independently. But here is the hopeful truth. By learning the triggers, the types of stroke, and the risk factors you can control, you can dramatically lower your risk. And if symptoms appear, knowing how to act quickly can mean the difference between recovery and lifelong dependence. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Part 1. What a stroke really is. Most people think of stroke as a single event, a sudden collapse that arrives without warning. In reality, stroke is a disease process that builds silently for years before the moment of crisis. Medically, it is defined as a condition where part of the brain suddenly loses its function for more than 24 hours, or results in death, with no cause other than a problem in the blood vessels of the brain. Put simply, a stroke happens when the blood supply to brain tissue is cut off. Without oxygen and nutrients, brain cells begin to die within minutes, and the body functions they control collapse with them. This is why stroke is sometimes called a brain attack. It is just as urgent as a heart attack. But many seniors fail to see it that way until it is too late. Globally, stroke is the second leading cause of death and one of the top causes of long-term disability. It is not only a statistic. It is a daily reality for millions of families who suddenly find themselves caring for a loved one who can no longer speak, walk, or even recognize familiar faces. In recent years, doctors have noticed a troubling trend. Because of Western-style diets high in fat, salt, and sugar, combined with rising obesity and diabetes, strokes are now appearing more often even in younger patients. But age still remains the greatest risk. Every decade after 55, the likelihood of suffering a stroke doubles. That makes stroke one of the most significant threats to older adults, both for survival and for quality of life. When stroke strikes, the damage is not limited to the brain, because the brain controls everything we do. A blockage or bleed in one area can paralyze one side of the body, rob us of speech, take away vision, or even strip away memory and personality. These are not just medical issues. They affect dignity, independence, and the ability to live without constant help. That is why public health experts call stroke not only a medical emergency, but also a social and economic crisis. Families are changed forever when one member becomes dependent overnight. And yet, the tragedy is that many strokes could be prevented. High blood pressure, diabetes, high cholesterol, smoking, and lack of activity are well-known risk factors. They are not always easy to change, but they are possible to control. Early recognition of symptoms, immediate medical care, and long-term prevention can all make a decisive difference. But before we talk about risk factors, we must understand that stroke is not one disease. It comes in different forms, each with its own dangers, treatments, and outcomes. If the word stroke sounds frightening, the types of stroke reveal just how different the threat can be depending on whether the brain is blocked or bleeding. If you thought stroke was just one simple condition, wait until you learn the two deadly types that attack the brain in very different ways. Part 2. The two deadly types of stroke. When people hear the word stroke, they imagine one single problem. But in reality, there are two very different kinds. Both are deadly. Both are emergencies. But the way they damage the brain and the way doctors treat them could not be more different. The first and most common is ischemic stroke, often called a brain infarction. This happens when an artery that should carry oxygen-rich blood to the brain becomes blocked. The blockage can come from a blood clot that forms right there in the vessel, called a thrombosis, or from a clot or debris that travels from the heart or another artery and lodges in the brain, called an embolism. Sometimes the blood vessel itself has narrowed over years because of fat deposits, a process known as atherosclerosis. Whatever the exact cause, the result is the same. Brain cells downstream are starved of oxygen, and within minutes they begin to die. Ischemic strokes account for nearly 80% of all strokes. The second type is hemorrhagic stroke, and though less common, it is often more devastating. This happens when a blood vessel in the brain ruptures and blood floods into the surrounding tissue. Instead of nourishing the brain, the blood now compresses it, raising pressure inside the skull and damaging cells by sheer force. High blood pressure that is left uncontrolled is the number one cause. But other triggers include weakened vessel walls from aneurysms, head trauma, or protein deposits that make vessels fragile with age. Hemorrhagic strokes can strike suddenly, often with a severe headache, nausea, or loss of consciousness. Unlike an ischemic stroke, where doctors may give clot-busting drugs, in a hemorrhagic stroke, those drugs could be deadly. Treatment often requires emergency surgery to stop the bleeding and relieve pressure. There is also what doctors call a transient ischemic attack, sometimes nicknamed a mini-stroke. It looks just like a stroke, but the symptoms vanish within minutes or hours. Some people brush it off because they recover so quickly, but that is a dangerous mistake. A transient ischemic attack is a warning shot. It means an artery is temporarily blocked and a full stroke could be only hours or days away. Ignoring it is like ignoring smoke before a fire. I once treated a patient who experienced sudden slurred speech for only 5 minutes. She almost stayed home, thinking it was stress. Luckily, her daughter insisted on taking her to the hospital. Tests revealed a major narrowing in one of the brain's arteries. With immediate treatment, she avoided a massive stroke that could have left her unable to speak for life. Understanding the difference between these types is not just academic. It explains why every suspected stroke requires an urgent scan to see if the brain is blocked or bleeding. The treatments are opposite, and the wrong decision can cost a life. That is why speed, awareness, and medical attention are everything. Now that you know the two deadly types, the next urgent step is learning how to recognize the symptoms the moment they begin. Because the faster you act, the better the chance of saving both life and independence. Part 3. Recognizing the sudden symptoms. A stroke does not creep in quietly over days. It explodes into life within seconds. One moment, you are speaking normally, walking steadily, or seeing clearly, and the next everything changes. That is why experts stress that stroke symptoms must always be treated as a medical emergency. No matter how mild or brief they may appear, the faster you recognize the warning signs, the greater the chance of recovery without permanent damage. The most well-known way to remember the key symptoms is the FAST method. Face, arms, speech, time. First, look at the face. Ask the person to smile. If one side droops or looks uneven, that is a red flag. Second, arms. Ask them to raise both arms. If one arm drifts downward or cannot rise at all, that signals weakness or numbness. Third, speech. Ask them to repeat a simple phrase. If the words are slurred, confused, or impossible to produce, that is another warning. Finally, time. If you see any of these signs, even one, it is time to call emergency services immediately. Every minute lost is brain function lost. But stroke can show itself in other ways too. Sudden loss of vision in one or both eyes, double vision, dizziness, vertigo, or severe imbalance are all possible signs. Some patients experience complete paralysis on one side of the body. Others suddenly cannot understand what is being said to them. Even though they appear awake and alert, there may be sudden confusion, problems swallowing, or loss of coordination that makes walking impossible. And, in the case of hemorrhagic stroke, a sudden, severe headache that feels like the worst of your life can strike without warning, often with nausea or vomiting. I remember one elderly woman who complained that her right arm felt heavy and she could not hold her coffee cup. She laughed it off as sleeping on it wrong. Minutes later, she stumbled while walking and her speech became garbled. Her family recognized the signs and called for help immediately. Because they acted fast, doctors were able to give clot-busting treatment within the critical window. Today, she is back at home, able to walk and speak normally. Without that quick decision, she might have been in a nursing facility permanently. The dangerous truth is that many seniors ignore these signs, blaming them on fatigue, low blood sugar, or even the heat. But stroke is never something to watch and wait. If the symptoms vanish quickly, it may have been a transient ischemic attack, which is still a warning that a full stroke could strike soon. Always treat it as an emergency. Recognizing the sudden symptoms is only the first step. What you do next, and how quickly you act, determines whether the outcome is recovery or lifelong disability. In the next section, we will explore why every minute matters, what doctors call the golden hours, and how emergency treatment can save both life and independence. Part 4. Emergency treatment and the golden hours. When a stroke strikes, every single minute matters. Doctors often say time is brain because, with each passing minute, Millions of brain cells die if oxygen and nutrients cannot reach them. That is why experts emphasize the golden hours, the first 3 to 6 hours after symptoms begin. Within this narrow window, certain treatments can reverse or greatly reduce the damage, but only if the patient reaches the hospital in time. For an ischemic stroke, where a blood clot is blocking an artery, doctors may use a clot-busting drug called tissue plasminogen activator. This medication can dissolve the clot and restore blood flow. But it is only safe if given within about 4.5 hours of symptom onset. In some cases, doctors can also perform a procedure called mechanical thrombectomy, where a catheter is threaded through the blood vessels to physically remove the clot. Both options can mean the difference between walking again and being confined to a wheelchair. But they are useless if the patient waits too long to seek help. For a hemorrhagic stroke, where a vessel has burst and bleeding is compressing the brain, treatment is different. Emergency surgery may be needed to stop the bleed, repair the vessel, and relieve dangerous pressure inside the skull. Medications are also used to control blood pressure, to prevent further bleeding, and protect the fragile brain tissue. Once again, speed is crucial. The longer the brain is under pressure, the greater the risk of permanent loss of function. I remember treating a patient who arrived just 2 hours after his speech suddenly became slurred and his arm weak. Because his family acted quickly, we were able to give clot-dissolving medication. The next day, he was already speaking more clearly, and within weeks he was able to return home. In contrast, others, who delayed by waiting to see if the symptoms would fade, often faced permanent disabilities that could have been avoided. The lesson is simple. Do not wait. Do not hope it will get better on its own. If you or a loved one show even one sign of stroke, call emergency services immediately. The golden hours are your best chance for recovery. Once they are gone, so is much of the brain's ability to heal. Now that you understand the urgency of emergency treatment, the next step is to explore how doctors confirm a stroke, determine its type, and guide treatment with precision. Part 5. How doctors diagnose a stroke. Once a patient arrives at the hospital with possible signs of stroke, doctors must move fast. Diagnosis is not just about confirming a stroke. It is about knowing which type it is, because treatment for a clot is completely different from treatment for a bleed. Choosing the wrong path could make the damage worse. So, speed and accuracy work together in these first critical minutes. The process begins with a rapid physical exam. Doctors use the FAST method again to check the face, arms, and speech. But they also look for additional clues. Is there sudden vision loss? Is the patient confused or unable to follow commands? Can they swallow safely without choking? These observations give the team a rough map of which part of the brain might be affected. Next comes imaging, the most decisive step. A CT scan is usually performed within minutes because it can quickly show bleeding inside the brain. If blood is seen, then clot-dissolving drugs are ruled out and the team prepares for surgery or other interventions. If no bleeding is seen, doctors may give medication to break up a clot. In some cases, an MRI follows, which can reveal even tiny strokes that CT scans might miss. These scans guide the entire treatment strategy. Doctors may also examine the blood vessels themselves. A carotid ultrasound can detect narrowing in the arteries that supply the brain. Sometimes angiography is done, injecting dye to see exactly where blood flow is blocked or where a vessel has weakened. If doctors suspect clots coming from the heart, An echocardiogram can show whether the heart rhythm disorder, atrial fibrillation, is sending clots into the brain. Blood tests add even more information. They measure clotting ability, cholesterol, blood sugar, and other risk factors that influence treatment. For elderly women who may already be on blood thinners or hormone therapy, this step is vital to avoid complications. I recall one patient, a 68-year-old woman, who briefly lost her ability to speak. By the time she arrived, her symptoms had faded, but the scans revealed a dangerously narrowed artery. Because she was diagnosed quickly, doctors treated her and prevented a devastating stroke that could have occurred within days. Diagnosis does not end when symptoms fade. A transient ischemic attack is still a warning, and urgent tests must be done to stop the next attack before it strikes. The next step is clear. Once the diagnosis is made, doctors must decide on treatment and long-term strategies to protect the future. Part 6. Treatment and Rehabilitation. Once doctors confirm a stroke, the focus shifts to saving life, restoring function, and preventing another attack. Treatment begins in the hospital with emergency care, but recovery often continues for months or even years. For ischemic strokes caused by clots, doctors may use clot-busting medication within the golden hours or perform a thrombectomy to physically remove the blockage. For hemorrhagic strokes, surgery may be necessary to repair the bleeding vessel and relieve pressure on the brain. In both cases, stabilizing blood pressure, controlling heart rhythm, and monitoring oxygen levels are crucial in the early hours. But the work does not end with survival. Rehabilitation begins almost immediately once the patient is stable. Physical therapy helps retrain muscles, teaching the body to walk, stand, and move again. Occupational therapy focuses on daily skills like dressing, bathing, and eating. Speech therapy is often essential, since many stroke survivors struggle with communication or swallowing. Each therapy is not just an exercise, but a pathway back to independence. Emotional and psychological care is just as important. Stroke can alter mood, cause depression, or make patients feel disconnected from their identity. Counseling and neuropsychology support help restore confidence and prepare patients to re-enter family and social life. Rehabilitation is not only about the body, it is about the whole person. I once followed a patient who could barely move her right arm after a stroke. At first, she felt hopeless, but through months of physical and occupational therapy, she slowly regained her strength. The day she buttoned her blouse by herself, she cried with joy. That small victory meant she was reclaiming her independence. Stories like hers prove that with determination and support, recovery is possible. Rehabilitation also requires strong family and community support. Caregivers provide encouragement, help with daily needs, and ensure medications are taken correctly. Without this safety net, many patients decline faster. With it, they thrive. Treatment is about stabilizing the present. Rehabilitation is about rebuilding the future. But neither can succeed without prevention. The final step in this journey is understanding how to stop the next stroke before it strikes. Part 7. Prevention and Protecting the Future. The most powerful treatment for stroke is to stop it before it begins. Prevention is the foundation of long-term health, especially for seniors who have already faced one attack or a transient ischemic episode. Doctors divide prevention into two categories. Primary prevention aims to stop the first stroke. Secondary prevention is about preventing recurrence in those who have already suffered one. Both approaches rely on the same principle. Control the risk factors that silently weaken blood vessels and allow clots or bleeding to occur. High blood pressure is the single most important target. Uncontrolled hypertension damages vessel walls and increases the risk of both ischemic and hemorrhagic strokes. By keeping blood pressure in a healthy range through medication, diet, and exercise, risk can be reduced dramatically. Studies show that consistent blood pressure control can cut stroke incidence by nearly 40%. Lifestyle changes also make a major difference. Quitting smoking immediately lowers the risk, since tobacco directly damages arteries. Limiting alcohol intake protects both the heart and the brain. Regular physical activity, such as brisk walking for 30 minutes most days, helps improve circulation, manage weight, and regulate blood sugar. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provides the nutrients vessels need to stay flexible and strong. Medical care plays its role too. For patients with atrial fibrillation, blood thinners prevent clots from forming in the heart and traveling to the brain. For those with diabetes or high cholesterol, proper treatment reduces additional risks. Even conditions like sleep apnea must be addressed, since untreated breathing pauses at night can raise blood pressure and strain the heart. I recall one patient who suffered a small stroke at age 70. She changed her diet, began daily walks, and followed her doctor's advice faithfully. 10 years later, she remains active, sharp, and independent. Her story shows that prevention is not about fear, but about empowerment. Every small decision adds up to years of healthy life. Prevention is the bridge between surviving today and thriving tomorrow. It is the daily commitment that ensures one stroke does not lead to another, and it sets the stage for the final message every senior needs to hear. Doctor's final words. After decades of caring for patients, I can tell you this with certainty. Stroke is not just a medical event. It is a turning point in life. It can steal independence, communication, and dignity in an instant, but it does not have to be inevitable. The body still remembers how to heal, and the choices you make each day either protect that gift or place it in danger. Recognizing the warning signs, acting quickly, and embracing prevention are not burdens. They are acts of self-respect and of love for the people who depend on you. I have seen lives transformed because a family member recognized slurred speech and called for help immediately. I have also seen the tragedy of those who waited, hoping symptoms would fade, only to lose precious abilities forever. The difference between those stories was not luck. It was knowledge and action. Your body is asking you to listen. Do not ignore the whispers of dizziness, weakness, or sudden confusion. They are not annoyances. They are alarms. But there is also hope with the right habits, medications when needed, and a strong support system. Stroke can be prevented, and recovery is possible. Every step you take, every meal you choose, every breath you slow down with intention is protecting your brain, is your heart, and your future. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned today and plan to apply in your own life. Let us support each other on this journey toward better health. If you enjoyed this video, comment 1. If not, comment 0. Do not forget to like, share, and subscribe for more health tips made just for you. Share this with someone you love, because awareness may save a life.